Hi everyone. Today we will be discussing another question based on integrated approach to medicine, and topic for today's question is Buerger's disease. Now see here. 32-year-old construction worker came to surgery OPD. 32-year-old construction worker came to surgery OPD with black pigmentation of distal fingers. He is a chronic smoker and has been smoking for past 10 years. He has no history of other chronic diseases. On examination, his brachial pulsation were palpable and radial and ulnar pulsation are feeble. He was advised angiography and it shows narrowing of distal arterial vessels. What is the correct combination according to above case scenario? So this is the clinical case scenario which is given, and in this 32-year-old male patient is given and black pigmentation of the distal fingers, and he is a chronic smoker, and there they have given that radial and ulnar pulsation are feeble. So you can infer from this that they are indicating towards a disease which is related to the arteries, because they have given that arterial pulsations in radial and ulnar vessels are feeble. And also the investigation they have done is angiography, and it shows distal arterial narrowing. So you can see that this is a disease pertaining to arteries, and in arteries we know that it is indicating towards a peripheral vascular diseases, and in peripheral vascular diseases, in PVDs, you know that in PVDs we know that there are two diseases which are given in the question. One is Buerger's and another one is atherosclerosis. Now we have to choose from both these diseases and we have to identify what is the correct option. So see here how to identify. Now one hint comes from this age group, 32-year-old male. Now atherosclerosis usually happens after 5th decade of life, greater than or equal to 5th decade of life. But Buerger's happens between 3 to 4, between 3 to 4th decade of life. And Buerger's is associated with, you all know that Buerger's is associated with smoking. And atherosclerosis, there is a treatment which is we do is stenting and bypass grafting. So we have to find out what is the correct option. So in the investigation they have written that narrowing of distal vessels. Another hint come from here, distal vessels. Now you all know that Buerger's firstly involve distal vessels and then progress to proximal vessels. So it has association with smoking, and there in the question they have given our patient is chronic smoker for last 10 years. So answer to this question, they are asking a correct combination. So correct combination is first Buerger's disease, and treatment advice you will give to the patient is smoking cessation, because this will help by allowing the disease to not progress further. It will try to stop the disease here itself. So answer to this question is 1 and 3. Answer is B option is the correct answer to this question. So ultimate aim of this question here, I am sharing this question because I want you to remember that there is a difference between a Buerger's disease and atherosclerosis clinically also, and in the question you have to identify there is a difference. So what is the difference you have to remember between the Buerger's disease and atherosclerosis is, see here, that Buerger's happens between third to fourth decade of life, while atherosclerosis start after fifth decade of life. So we can say that Buerger's in younger patients as compared to atherosclerosis, and Buerger's progress from distal to proximal, while this progress from proximal to distal. Buerger's is associated with smoking, and there is no such association in atherosclerosis. No role of bypass and stenting in Buerger's disease, while a treatment of choice in atherosclerosis is stenting or bypass grafting. Why no role of bypass and stenting in Buerger's? Because you see, you know that due to it progress from distal to proximal, so there is no role of such bypass and stenting. So I am sure that you have understood this question, and the ultimate aim is you have to remember that there is a difference between the Buerger's disease and atherosclerosis clinically and also in the theoretical examination, and they will try to give you this type of scenarios, and they can also give here that different type of scenario in which they can replace this as a proximal, and they will change the option, and answer will be shifted from Buerger's to atherosclerosis. So lastly, I want to say that these type of scenarios are currently in fashion, and you have to practice multiple questions like this, because in today's exam these type of questions are in fashion. So try to practice these questions, and I will be sharing more and more such clinical questions on my channel. So like, share and subscribe my channel, and also share this video among your friends. Thank you and thanks for watching.